we're dealing with ECG. So what is an ECG? ECG is simply electrical activity. See, when you say it's simply electrical activity of heart. Electrically active heart in what? In a graphical manner. Right? In a graphical manner. Okay. So that's it. Now, whenever you hear about ECG, so you always have a word that comes to your mind, that is leads. Right? This word will come to your mind every time when you hear ECG. Okay. So so that the leads has a basic thing to deal. When you deal with ECG, you have to know something basic about leads, right? So what we'll be learning first is about leads, the axis. That's our first priority, especially this axis. Then we will deal about what? The P wave, the QRS complex, the typical patterns. Then we'll deal about situations. Okay, so it's good to start, right? Okay. Now we'll be dealing with axis of ECG, right? Okay, axis of ECG. Whenever I say axis of ECG, a picture should come into your mind with a full confidence, and that's the ECG's leads are. This is lead 1, this is lead 2, this is lead 3, this is okay. There are some 2 more leads. I'll tell in a few minutes. Before that, we should have a common understanding or basic understanding. What is the relation between lead 1 and lead 2? And the relation between lead 1 and lead 2 is simply a 60-degree axis. Lead 2 and lead 3 also has the same degree. Lead 3. Okay. Now the other leaders, lead AVL and AVF. So how you remember AVF, or how you know that AVF is a lead that's in lead 1, in 2 and 3, or it is pointing towards down? Simply the word F, right? It's simply the word F. Okay, the word F. Why F? Yeah, F means F simply points to foot. Okay, so the axis is 90-degree, right? You can remember like that. Okay, this angle is 30-degree, or the relation between the axis or lead 1 and AVL is 30-degree. So you get it right. Okay, now you'll be something comes to your mind, comes to your mind with some words, right? This is a very common when you say, or when you discuss about ECG. That is, sir, this ECG has a normal axis. Sir, this ECG has a left axis deviation. Or someone say, or some patients may present with a right axis deviation. So we're wondering, right? See, this is, in my case, I was as a house surgeon. I always wondered. I was zero knowledge about axis, zero knowledge about the axis, about ECG, all over. I was a big zero. So before knowing about the left axis and the right axis, we should always know about what? We should always know about the normal axis. Okay, so we'll be dealing the normal axis. See, I'll be in a few minutes. I'll be talking you how to find the axis from an ECG. Now whatever comes in between lead 1 and lead AVF, whatever comes in this area, that is, whatever comes in this area, we say that it's a normal axis. Okay, we say that it's a normal axis. We say that this is a normal. We say that this has a normal axis. Anything that come to this area, let's come to this area, it's known as left axis deviation. It's known as left axis deviation, that is between AVL and lead 1. And everything that comes between lead 3 and AVL, we say that it has a what? It has a right axis deviation. Okay, a right axis deviation. Okay, now you'll be wondering how to find axis from an ECG, right? This will be your question. Okay, we'll be dealing with it. The easiest way, or the way to find the axis from a deviation, is you should find the leads that have what? This next word is the most important. Tallest what wave? R waves. The tallest R waves. The tallest R waves represents the axis of the ECG. I'll show you an example. Okay, if I for example, I have this one. What I get is, when I have the R waves in lead 1, lead 2 and lead 3. Okay, in lead 1 I got it as 3 point something like 3.5 small boxes. Okay, and in 2 I got it as 3 small boxes. In lead 3 I got it as 2.5 small boxes. Okay, so this is 2 leads in which we have the most tallest R waves. So the axis will be between 1 and 2. See now, see which shows 1 and 2. This is 1 and this is 2. So the axis is this. Okay, is it normal? Yes, it's normal. It's normal axis deviation. This is how we find the axis of an ECG. Okay.